what to look for when checking an injury, okay? Checking. And how caused. So mechanisms, okay? Then if you can remember, it's a very personal choice. If you can remember, it's a good idea to look at these questions too. For example, here it says elevate leg, okay? Maximum dose of morphine and IM, okay? Extra padding, respiratory depression, and what should be used, okay? Freshly applied plaster, cover. Analgesic, allergic to morphine, okay? And severe pain persists, okay? And what condition? Okay. So then we can quickly go and look at the text. Okay. So as you can see, this is fractures, dislocations, sprains, part A, text B, and text C, text D. Okay, and that's it. Okay, so quickly we look. Right. Fractures. Right, what was the first question? Remember?
No.
Okay. Yeah, procedures for delivering pain relief. Okay. Now, so what do you think? Now, if we quickly look, is fractures, what happens, they occur following injury, dislocation, sprain, so it actually explains what they are. Then immediate management, clinical assessment, and management. And then here, drug therapy protocol. And here, techniques for plaster back slab for arm fractures or leg fractures. Okay, so if we go to question, right, procedures for delivering pain relief. And where is it? In text A, B, or C, or D? Can you guess?
Maybe C
or C.
Okay.
C for treatment.
Okay, maybe C. Splinting fractured limb.
Splinting fractured limb. I think D.
D, it's a procedure, okay?
Procedure.
And record when assessing a patient, what to record?
B.
Yeah, so that is, it's probably here, yes?
Yes.
Okay. The terms used to describe different types of fractures.
A.
A.
Is it?
Yes.
Yeah, we say closed and compound. Practitioners who administer analgesia.
Practitioner who administer analgesia. Maybe C or B.
Yeah, it is C, yes. Health worker, media officer, nurse practitioner. Okay, so that is C. And what to look for when checking an injury? Okay, checking the injury. What to look for? So it's probably in the assessment, yes?
B, yes.
Yep, okay. And how fractures can be caused? Remember?
A, maybe.
A, yes. Yeah. So they have twisting, violence. Okay. So the only one that we weren't sure was which one?
B.
The first one.
First one. First one.
The first one. Procedures for delivering pain relief.
Pain relief.
What are the procedures? Do we have any procedures? Can you see?
I think in D was procedures.
How about C?
C. There is only drug and no procedure.
Okay, so let's go.
I think it was C. Fear management.
Yep, exactly. That is elevate limb, sling, pillow. Okay, so that these are the procedures. These are the things. So one of them is So
Yes.
basically, that is B. Okay. So as you can see, we don't even need to read the text. We in 7 questions, we can quickly answer them. Okay. Now, what should we use to elevate a patient's fractured leg? Remember?
Management maybe.
Okay.
B.
Uh, pillow for leg injuries. Okay.
Yes.
So we write pillow. Maximum dose of morphine per kilo IM.
C.
Where should we look for it? We need to write the dose.
Yes. C.
Okay, we need to look it in C.
Table.
IM. Okay, IM dose, maximum dose is 10 milligram.
Yeah.
Okay, but it says per kilo, so that's 0.2 milligram per kilogram. Okay,
Per kilogram. Yes.
yeah, it says per kilo. So which part of a limb may need extra padding? Where should I look for it?
Management.
How about here? Plaster.
Plaster maybe.
Yeah, because it says, yeah, when do we use padding? When we plaster. So quickly scan for extra padding, okay? Uh, extra padding
Extra
is,
panel line. Yes. There.
so over bony prominences, okay? So we say bony prominences, okay? And 11, what should we use to respiratory depression? Where should we look for it? Respiratory depression. Uh, respiratory depression is rare. If it should occur, give naloxone. Okay, naloxone. Overly cover a freshly applied plaster. Where should we look?
Plasters. D.
Okay, so what we should use to cover a freshly applied plaster. Okay, what should we use? A crepe bandage. Okay. What happened? So, what condition might a patient have if? Oh no, sorry. What analgesic should be given to people allergic to morphine? Where should I go?
C maybe.
Okay. Allergic. Do we have allergic here? No.
No.
Okay, we go up to management. Analgesia. Morphine. If
Allergic
allergic,
morphine.
fentanyl. Okay.
Fentanyl.
So the answer is fentanyl. Okay. What condition might a patient have if severe pain persists after splinting, elevation, repeated analgesia? Yeah, you would probably know that. This is compartment syndrome, okay? So that's a splinting, elevation, or 2 doses of analgesia. So it could be compartment syndrome. Okay, going to the next part. Complete each of the sentences with a word or short phrase. Falling on outstretched hand is a typical cause of a
Fracture.
fracture or dislocation. Which one is that?
Elbow maybe dislocation.
Okay. Let's see. Yeah. Falling on an outstretched hand causes elbow dislocation. So you need to write based on what is in the text, okay? Upper limb fractures should be elevated by means of what? So the leg was a pillow, remember? Where was it?
Yes.
It was somewhere here, yeah?
Management.
Sling, okay?
Yes.
Pillow for leg, sling, okay? So the answer is sling. Make sure patient isn't wearing any what on the part of the body where plaster back slab is going to be placed. Where should I look?
Plaster side D.
Okay. Ensure any jewelry is removed from the injured limb. Okay, so that would be jewelry. Okay, any jewelry is removed. Check to see whether swollen limbs are what or increasing in size. Okay, where should I look for it?
Maybe plaster side or
Okay,
management.
swelling or yep. Should we go to management? I think that's probably a better place. Um, okay, yeah, yeah. Uh, Probably in the examination, yes. So if
Let me check. Yes.
the limb is swollen, is throbbing or getting bigger, okay? So the answer is throbbing, okay? In a plaster back slab, there is a layer of what closest to the skin? Where should I look for it?
D.
What is closest to skin? Cotton stockinette, yeah?
Yes.
Okay, so the cotton padding or cotton stockinette. Uh, Patient aged what and over shouldn't be given the higher dosage of pain relief. So dosage, where should I go?
Management.
No,
Yes.
dosage.
C. No, C. Right.
C.
C. Right.
Uh,
C.
70,
Yes.
more
I
than
think
70.
it was
Yeah.
70. Yes.
So
Under the table.
yeah. So this is 70. So the answer is patients aged 70 and over shouldn't be given the higher dosage of pain relief. You can write word 70, or you can actually some people ask how about numbers. Yes, it says here it can include words, numbers, or both. Okay, so if you write 70 in number, that is correct. Okay, so how long did it take? 18 minutes. Yes,
18.
18. Yeah, it's
Yeah.
we started maybe 17 minutes. Actually, we talked in between, but in 15 minutes, basically, you can do this. And you don't need to read everywhere. Um, this is not a very difficult one. It is quite easy. But as you can see, what I did was skimming and scanning. I quickly looked. I didn't read the whole thing. Did I need to read this part?
No.
No. Okay. But what I did, okay, I did some quick look, which is called skimming, and then I did some scanning. It means, uh, okay, so we did, sorry, what was I saying? Uh,
Quick look, skimming.
yes, and then we did scanning. How I, for example, looked at throbbing or getting bigger. I looked for getting bigger. I found throbbing. Okay, and then allergic to morphine. Then I looked for allergic, which is here. Okay, and I found fentanyl, and this is called scanning. So I find a keyword and then I choose a keyword, I go scan it. And I know roughly where it is because I have skimmed the text. So I know that this would be in management or in text C. That's why I come and scan here. So I don't scan the whole text. Okay?
Okay.
And sometimes we need to read a little bit more closely. Like here, we have to read and see, okay, cotton padding. So I had to read to find cotton padding needs to be put. Or jewelry is removed. So I actually had to read more closely. Okay, uh, yeah, so these are the techniques, right? Now you might say, how do we choose keywords? Do do you have any problem with choosing keywords?
In the questions, I
Yes.
think no.
No? You
No.
everybody okay? Comfortable with that?
Yes.
If,
That okay and hello, of course.
Hi,
Hi,
welcome back. Okay,
thank you.
so yeah, usually we choose a keyword which is unique. Okay, so if the whole thing is about fracture, so we don't choose fracture as a keyword. Okay, but as you can see, um, we choose something which is different from the whole passage. Okay, now what is skimming? Did we talk about skimming?
skimming,
Yes.
quick look.
Okay. So, yes, one of them is quick look to see what is what. So we know that part A is we quickly looked, text A, we saw fractures, dislocations, sprains, and their definitions. Part B is um, immediate management, assessment, and management. And text C is about medications, okay? And D is backstab. So basically, we familiarize ourselves with what is what. Okay. The next thing, there is more to skimming. Skimming is not just that. Sometimes you actually need to quickly go through the text. Example here. Now, listen to me and see what I say, okay? I say technique, plaster backslab, arm fracture, leg fracture, length of non-compression cotton stockinette halfway, middle finger, below elbow, 2-3 centimeters, more than distal forearm, wrap cotton padding, full length, 2 layers, 50% overlap, measure length, plaster Paris 1 centimeter shorter than padding stockinette, 10 layers, same length, immerse layer plaster bowl, room temperature water, holding each end gently squeeze, excess water, ensure jewelry removed, lightly mold slab, contours of neutral position. Pressure on bony, no pressure on bony, extra padding on bony prominences, and wrap crepe bandage firmly. Okay, so that's what I did, and um, how long did that take me? Maybe less than a minute. But this is what we want to achieve, basically, to just look at the keywords and key concepts, okay? And just to understand that, basically, how long um, should it be, and 2-3 centimeters, and then cotton padding, how long, and 2 layers, 50% overlap. So these are the key information. I don't need to read the whole thing, say wrap cotton padding over top for the full length of the stockinette. No, what I need is wrap cotton padding, full length stockinette, 2 layers, 50% overlap. And that is the information that I need. Okay. Or for example, this one, measure length of plaster pads 1 centimeter shorter, padding is taken at each end, roll in about 10 layers, same length. Okay. So basically, what I do, I don't read the whole thing. I just look at the key information. Okay. Immerse plaster, room temperature water, holding each end and gently squeeze excess water. Okay. So I don't need to say gently squeeze out the excess water. No, gently squeeze excess water. So I don't need this bit. Or jewelry removed. Okay, ensure jewelry removed. So that's the whole of this. Jewelry removed. So this is called skimming, basically. So even if you need to read one part, you need to actually skim, and you don't have time to read. Okay, you definitely wouldn't have time to read the whole thing. Some people say don't do part A first. Just sorry, don't do these first matching questions first. But I absolutely say do this first, okay? Because that will tell you what is where. And that's why they put it in the first section, because that way you will be finding the answers more easily. You would know where to go and look for or scan for elevate and leg, okay? So some candidates ask, are the questions in the same order as the text or as the no, it can be maybe second question is from the last part, maybe third question is from the first part. Okay, so basically they are not in the same order. Any questions?